Hello again, everyone. This is Braswell Dean from the Providence Hospital Department of Family Medicine, and we're back again for Codeology Part 4. We are going to be looking at our coding game again. This is our interactive game that lets us try to put the rules of coding into clinical cases that you, the doctors, can understand pretty easily and pretty quickly. So again, this is intended for our residents, any visiting medical students, or even faculty that want to brush up a little bit on some of the basic rules of coding. Again, we're not trying to turn you into a medical coder or a professional like that. We're trying to make things easy for you, to break down things in a way that you can put these rules easily into your practice and make a difference. And again, our mission is to try to encourage you to always do the ethical thing and the right thing. And of course, if you have any questions, again, you need to consult your hospital coder or your office coder to try to help you if there are questions that we can't answer here. Obviously, all of these things are general rules, and they may be subject to change as the years go by. But as of the time of this, all of this, again, are the classical rules of E&M coding. And so we are going to continue to try to emphasize letting the complexity of medical decision making, which is composed of the risk, data, and diagnostic management decisions. We're going to try to emphasize letting this MDM be the ethical standard which drives the decision for the coding that you do. It allows you to know that you're doing the most ethical coding for the services that you provide, and it gives you that objective yardstick that you can feel good about making those decisions. So we're going to jump right in and start off. We've talked about risk, we've talked about data in our previous sections, and so now we're going to be talking about the diagnostic management decisions. And again, these three sections, if you just learn these three sections, it is going to be so easy for you to learn, to be able to determine the MDM and to have ethical coding. So we've already seen how easy risk is and data is. Let's now look and see how easy diagnostic management is. Okay, let's jump right in. You've seen a patient with a history of hypertension, diabetes, and asthma. All of these problems are stable. What is the value of the diagnostic management decisions in this category? What is the value? So again, if you have your worksheet in front of you, now's a great time to pull it out and make sure you're looking at it, because we're going through it together. And if you don't have a copy, you can either try to print the screen so that you could have something to see, but in any event, I'll have it for you right here during the video. So again, this is our worksheet with the risk, the data, the diagnostic management decisions categories are here. And we're learning how to know what these categories are so that we'll learn how to calculate the complexity of medical decision making. Risk was really easy, data was really easy. Now let's look at this. It's divided into minor problems and established problems and new problems. And basically, you just give yourself the proper points for these and add them all up, and that's what you get. So let's just go back to our first question, data for 10. We have this patient with a history of hypertension, diabetes, and asthma. All of the problems are stable. How many points in this category do we get? Well, we get a point for every problem that we are reviewing or managing. And let's take a look at the worksheet for just a minute. For established problems, if they're doing well, you get yourself 1 point. If they are not stable, you get yourself 2 points. And there may be a typo here because there should be the letter number 1 here. But just know that for established problems, you get 1 point. For problems that are poorly controlled, you get yourself 2 points. Again, an established problem, well controlled, 1 point. Established problem, poorly controlled, 2 points. So let's go back to this question. A patient comes in with a history of hypertension, diabetes, and asthma, and all the problems are stable. What is the value in this category? Again, it seems pretty easy, doesn't it? It's kind of like, I've called this section the how everything's going section, because patients are coming in, grandma's coming in with hypertension, diabetes, and asthma, and everything's doing okay, 1 point. Okay, now let's go back and do diagnostic management for 20. The patient comes in to see you with a past medical history of hypertension, previous stroke, rheumatoid arthritis, depression, and hyperlipidemia. The blood pressure is 182/92, and all the other chronic diseases are stable. The patient requests management of all these problems. That's why she came in to see you. I want you to kind of check me over. In this category, what is the value of the services that you're rendering in diagnostic management decision making? And as we've said before, if the problems that you're managing are all stable, you get yourself 1 point. If they're poorly controlled, 2 points. So in this example, hypertension is worth 2 points. The previous history of stroke, rheumatoid arthritis, depression, and hyperlipidemia, and perhaps the patient's on medication for these things, or you're having to order some tests for these things, or make decisions based on these things, are all 1 point. So 2 plus 1 plus 1 plus 1 plus 1 is 6. Okay, so you get 4 established problems, good control, 4. 1 established problem, poor control is 2. So this is a really easy section for us too. Let's look at diagnostic management for 30. A patient comes in and is seen with hypertension and diabetes, and both of these are suboptimally controlled. You're managing both problems. What is the diagnostic management value for you? Let's look at our worksheet again. And we've got 2 problems. Both are poorly controlled, so 2 times 2 is 4. So we get 4 total points for these 2 problems being so poorly controlled. So we see this example. 1 times 2 is 2, 1 times 2 is 2, 2 plus 2 is 4. You know, I think you guys, you may feel like you've got this section down pretty good too, because this is an easy section too. How's everything going section? Let's go on. Let's look at diagnostic management for 40. A patient comes in with a new complaint of back pain, and you diagnose acute lumbar strain, and you treat with a trial of nonsteroidals, and you tell the patient to follow back up with you in 4 to 6 weeks. Now, this isn't a chronic problem anymore. We're into sort of new problems. So let's go ahead and look at our answer, our worksheet, and you see now we've got established problems here. Now we've got new problems over here. And we've got, instead of adding up all the established problems over here that are either poor or well or stable controlled, now we've just got a fixed value here. If it's a new problem and no additional workup, is 3 points. And remember, this is 1 problem max. So in other words, if the patient comes in with 3 new problems, hey doctor, I have a backache, I have nasal congestion, and you know, I have a sore thumb. Do you get 9 points? No. You just get one new problem max. You get 3 points. So it's kind of a bummer for you if you got a patient coming in with 5 new problems or something like that. And you think, oh, I have 5 new problems. But if it's a new problem, no additional workup, it's 3 points. Because remember, these things only go up to 4 anyway. So if the problem needs a workup, it's 4 points. Now, this always causes more questions. In general, we're just asking questions when they come in with one new problem anyway. But the questions then tend to reflect on, well, what's the workup? Number one, is it a new problem needing a workup? Well, if you order a CBC, that's a workup. If you order an EKG, that's a workup for the new problem. Somebody's coming in with chest pain, you get an EKG, that's a new problem with a workup. Suppose you have a patient and you order an HCG, that's a workup, or you order a wet mount, that's a workup too. So anything you order needing a workup gets 4 points. Whether it's shortness of breath, needing a chest x-ray or a pulse oximeter in the office, or a workup that just involves a urine dipstick, it's all 4 points. The dipstick is the same as getting a stat EKG. So you can't split hairs here about which one feels the most important. If it's a new problem to you and the practice. Now, if the patient's been coming in for this before, and that she always comes in for chest pain, she just hadn't seen you because now your partner who's always on vacation is on vacation again, and now you're seeing the patient, it's not really a new problem because if it's in the problem list, the patient's coming in before for the same thing, it's not really a new problem. So if it's a new problem to the practice, it's a new problem to you, that's how you interpret this. And we always defer back to the most ethical way to apply these rules to these questions and patient scenarios. So let's look at this again. We talked about this hypertension, diabetes, suboptimally controlled, that's 4 points. And so the next question is this new complaint of back pain. You diagnose acute lumbar strain and administer a trial of nonsteroidals. What is the value here in diagnostic management decision making? So again, a new lumbar strain is 3 points. It's a new problem. No additional workup is necessary. Why? Because I know it's back pain. I know it's lumbar strain. I don't need to order an x-ray for this problem. No additional workup is needed. A patient comes in complaining of fatigue, and you decide to check a CBC. What is the diagnostic management value? And as we've said before, new fatigue needs workup. You get 4 points. And you say to yourself, well, you know, fatigue doesn't sound like a big deal. You know, you're telling me that chest pain with shortness of breath needing a workup would be 4 points, but just fatigue, that equals 4 points too? And the answer is yes, it does. You as the doctor can't distinguish between what's more important feeling to you. It's just the fact that it's a new problem, and the workup could be something as simple as a CBC. Again, as we look at this section here, we talked about new problems, no additional workup, easy 3 points. New problem needing a workup, easy 4 points. And it doesn't matter at this point if the patient has a whole bunch of, other problems that are doing well or poor. I mean, if you have a new problem needing workup, you've already got yourself 4 points. It's academic at that point to try to count up like, whoa, you know, Granny has 10 problems and they're all stable, so that must be 10, and Granny has a new problem, and that must be 14. So where's my 14? The answer is it stops at 4, so don't worry about it. These are so easy. Established problems, new problems. And then you say to yourself, what about all these minor problems? And we didn't even include an example of a minor problem. I think somewhere in the case examples we'll have an example of a minor problem. This I would sort of consider, just to describe it a little bit for you, it's like you got your hand on the doorknob, you're getting ready to leave the room, and this is like an oh, by the way question. These minor problems are oh, by the ways. Oh, by the way, Doc, before you go, what do you think about my nose? You think it's too big? No, I don't think it's too big. Oh, well, let me ask you another question. Oh, by the way, you know, look at my fingers. Are they too crooked? Or, oh, by the way, what do you think of this? Is my skin too dry? Or, oh, by the way, you know, all of these questions, when patients ask you these multiple problems that seem really minor, seem really self-limiting, yes, you can get credit for that. Now, most times in a busy office, doctors just do this kind of advice gratis. They're asking you a bunch of questions. Why? Because Granny's already there for her diabetes, hypertension, and COPD. And maybe has a new problem of something else going on. And, you know, you've already maxed out anyway. And then, so all the other questions that the patient will ask you is kind of gratis. Yes, technically, yes, it is kind of gratis work. You're just answering questions at that point. But, technically speaking, I mean, it won't, you know, if you're following these rules, all those other things that you're answering doesn't increase the coding for the services that you're going to render that day. So you don't have to worry about that. But, you know, make sure your EMR is not racking up things. But these questions, if you do, you can document all that, and this is the impact that it would theoretically have on the coding for the services that you do that day. So let's say your EMR is recorded that you've answered 17 other questions, even though Granny's here for the regular stuff. I mean, those 17 other questions are in the assessment and they get put somewhere. But first off, you got to remember these minor problems are minor problems because you say they're minor problems. This might be a sentence in your assessment that says other minor problems discussed, big nose, crooked fingers, bad breath, or whatever you want to put in there. And then you could put something to the effect, you know, reassurance provided or symptomatic care provided. They're minor problems. Why? Because you say they're minor problems, number one. And if they ask you one question, you get 1 point. And anything beyond one question, 2 or more, is just 2 points. So in other words, if Granny asks you or about, you know, a skin problem and you think it's a minor problem, your skin's fine, Granny. But if she just throws at you everything, and they're all minor problems, and you've already spent all your real time dealing with the established problems, yes, you could give yourself 2 points if you really wanted to or you had to. It might not change the code. But let's say somebody comes in with one problem that's stable or maybe no established problems, and they just ask you zillions of little questions. Yeah, you could give yourself 2 points for just talking to the patient and answering little questions. You could say multiple minor problems discussed, give yourself 2 points there. So we've tried to review another super duper easy section, the diagnostic management section. And we've talked about what minor problems are. We've talked about more or less your bread and butter or your established problems, whether they're well controlled or poorly controlled. And more often, the new problems, whether you're working them up or not. And this is such another easy section. So I put this in here so you could learn this. And now we are going to go to the next section where we put all of these three sections together with clinical cases. And now we are going to practice deriving complexity of medical decision making and see how easy that is for your practice. So we'll stop here. I hope this was helpful, and we'll take up next time looking at scenarios and learning how to calculate complexity of medical decision making. Thanks, and we'll see you in the next tutorial.